I've done videos about the anatomy of the uterine cavity. I've also done videos about the menstrual cycle. In those videos, you will understand why a healthy endometrial lining is everything, especially at the early stage of the process of getting pregnant. But just a quick rundown for those of you who are watching this video before watching those other videos. The endometrial lining is where the fertilized egg, otherwise known as the zygote, will then come and implant itself. So if you have a submucosal fibroid that is just sitting right underneath the endometrial lining, as a fertilized egg is implanting itself into the endometrial lining, it will come across the fibroid that is sitting underneath the endometrial lining. So this fibroid will interfere with implantation. And in the instance where the embryo does manage to go through the first stage of implantation, it's unlikely that this implantation will result in a successful pregnancy because the embryo will not be able to successfully anchor itself into the endometrial lining and get the support it needs throughout the pregnancy because of the presence of this submucosal fibroid. So if you've been trying to fall pregnant for any length of time, so again, one of the things that you want to have made sure that you have had done early is an ultrasound. The ultrasound will be able to pick up the fact that you have a fibroid. It will then be up to your doctor to assess the ultrasound images and be able to say you have this type of fibroid, and so therefore this will not affect your fertility, or that you actually have a submucosal fibroid, which is actually most significant when we talk about how fibroids can affect your fertility. Also, another uterine cavity pathology is multiple polyps. So these polyps are usually fluid-filled sacs or rather small sacs that can be found in one position of the uterine cavity or multiple positions of the uterine cavity.